Hi, I'm Dr. Dhillon from Ludhiana Dental Center, and today we'll be talking about conscious sedation. Now first, what is conscious sedation? It is the administration of medication to the patient for placing the patient in a relaxed state for the dental treatment. Now when is the conscious sedation actually used? First, it is used for the apprehensive or anxious patient. Especially you would have seen the kids, they are very apprehensive and they are revolting and they are uncooperative about the dental treatment. So it can be used then. Second, when the patient has to undergo some long or some complex or difficult dental procedure. For example, if a patient has to undergo multiple dental extraction or surgical extraction of a wisdom tooth, then we can use the conscious sedation. So now it comes, what is it like to be under conscious sedation, or what are the characteristics? Alright, first of all, the patient will feel a little sedated and free of anxiety. There will be no anxiety. Second, the patient will be more relaxed for the particular dental treatment. Third, the patient will be responsive to various stimuli. For example, verbal commands from the doctor. For example, open your mouth, close down, and other such commands, the patient will be fully responsive. And fourth, the best part is the protective reflexes of the patient. For example, the patient is breathing or coughing, such protective reflexes are always active. Now we come down to the advantages of conscious sedation. First, it reduces the fear of treatment for the patient. The fear of treatment that is being planned and the fear of treatment that is being carried out for the particular dental treatment. Second, it makes the patient tolerate long or difficult procedures more easily. And third, the pain threshold is increased, which is why the pain perception is reduced. The patient feels less pain for that particular dental treatment. Now let's talk about the modes of administration of this conscious sedation. How exactly can conscious sedation be given to the patient? First is oral. That is, you can take a syrup, for example for the kids, like we have pedicloral syrup, or we have various other syrups which are available in the market, or any other sedative medication which can be administered to the patient, like in the form of tablet, inhalation of a tablet, right? Second is injectable form of administration. In this, injection is given to the patient mostly intravenously, and it shows effect for the sedation. And third is which is the best way to sedate the patient, is like as you can see over here, we have it here, is the inhalation form of administration. Now with the inhalation form, you can see this is a small selector dial where you have gas increase or decrease. You can increase or decrease the amount of gas that is being administered to the patient. Now how this works? This is commonly when I see any NRI patient coming to the clinic, or any other patient, they usually ask me, oh, doctor, do you have the laughing gas? So this is commonly known as laughing gas or inhalation mode of conscious sedation. So what this does is, first it has a flow of nitrous oxide and the oxygen. As you can see, there are two dials over here for nitrous oxide and for the oxygen, and there is a small regulator here to control the flow of oxygen and the nitrous oxide. So when the nitrous oxide is increased, the patient feels more sedated, and when the oxygen is increased, the patient feels more relaxed, is active, recovered, and ready to go back to work. Now why is this? I just told you it's more advantageous over other methods. Why is this more advantageous? Now first and foremost advantage is ease of administration. This is administered with a small nasal masks which is placed on the patient's nose, and the patient is asked to breathe in. Now the best part is the air is like normal air you're breathing. It's odorless, it doesn't cause any form of irritation. So it's fairly comfortable to the patient, especially as compared to injecting the anesthetic or drinking some sort of a syrup. Second biggest advantage is onset is very rapid. So within 2 minutes the patient is sedated and you can carry out the procedure that you want. Now the third, the best advantage of conscious sedation by inhalation method is that the patient recovers equally quickly. So as I just told you, nitrous oxide makes the patient sedated. You just turn the dial to oxygen. After the procedure, oxygen is administered to the patient. Now when the oxygen is administered, within 2 minutes, the patient is recovered fully from the sedation, is ready to get up from the chair, walk out of the clinic, and carry out his day-to-day activities. So it's very advantageous, especially in comparison to other forms of conscious sedation. For example, if you've taken a drug, it is going to last for at least 8 hours, be it oral, be it intravenous. But in this particular case, you recovered within 2 minutes and you are ready to carry on with your day-to-day activities. Plus, you had a very comfortable and beautiful procedure. Dental treatment was exceptionally comfortable for you. Last but not the least, we always employ a licensed medical practitioner, licensed anesthetist for carrying out such form of procedures because safety of patient is paramount importance.